Welcome to Petability. I'm your host, Kathy Simons, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, my friend Kathy. How are you doing?
Good afternoon, Chris. I'm having a fantastic day, and I am on the edge of my seat because I'm so excited about our topic for today.
I know. I must say it's not something that that came to, top of mind. Then when Merck Animal Health reached out and said, we have these esteemed doctors that can talk about the uptick, see what I did there? Uptick of Lyme disease. And why should we care, right? Why is this a topic that really matters? Well, it does matter. It matters to all dog owners, certainly. And I'm hoping that our guests can shed light on a lot of things that maybe average pet owners don't really consider when their dog may get a tick or, so what is Lyme disease, first of all? What are the common symptoms? What are the signs that pet owners should look for? How do we treat it if your pet happens to get it? And then how do we prevent it? Because I think that would be the best thing overall, right? Let's not even go there. Let's prevent tick-borne diseases altogether if we can.
Right. And I'm interested to find out, I'm going to ask the doctors, should we call this an epidemic in our veterinary community with animals? Because I would say, Chris, we see a large percentage of dogs who are coming in to see us for rehabilitation who have arthritis because of secondary to having, Lyme disease.
Mm-hmm.
And I would say my percentage is probably 60, maybe even 70% of my patients. So I'm really interested to hear what they have to say today.
And also, kind of interesting for me is that I had moved here from Colorado, and that was 20 years ago plus. We didn't talk about ticks so much in Colorado. And now moving to the East Coast and the prevalence, yes, 20 years later, it sounds like there is definitely an uptick, but also, regionally, it seems to have greater numbers, in different parts of the country and so forth. So I hope we can explore that a little bit. Kathy, when we start our shows, we often jibber jabber a little bit. And I was like, well, which tick story should I tell? And I had 3 to choose from. And I'm like, pros and cons. And then it's like Murphy's Law, right? So I'm out and about yesterday. I'm in the car and, I kind of feel something and I go to itch it and I'm like, what is that? It's not moving. And I freaking had a tick on the back of my thigh.
Disgusting.
Can you believe it? Like the day before we're interviewing these doctors about tick-borne diseases and Lyme.
Just got you excited about ticks and diseases.
And I'm hoping they tell me I'm not going to get Lyme disease.
I hope they do too. Yeah, I hope so too.
Yeah. So I just thought, wow, that was serendipitous. Anyway, let me tell you a little bit about the 2 doctors. So we actually have 2 guests here today, Doctors Duncan and Greene. And they're each going to answer our questions and discuss points based on their areas of expertise. Dr. Kathryn Duncan is a DVM, PhD, and DACVM in parasitology. And she is a senior professional service veterinarian field specialist in parasitology for Merck Animal Health and an adjunct assistant professor in the veterinary pathobiology department at Oklahoma State University's College of Veterinary Medicine. She graduated from the University of Tennessee's College of Veterinary Medicine, completed a residency in veterinary parasitology through the National Center for Veterinary Parasitology, obtained a PhD in biomedical sciences at Oklahoma State University, and is a diplomat of the American College of Veterinary Microbiologists, board certified in parasitology. And each of the doctors had a little quote that was printed in their bios, and I just love this. So according to Dr. Duncan, parasites are the most interesting bugs out there. I can barely contain my excitement when I get to teach others the most efficient ways to protect our pets against these ubiquitous threats. Dr. Duncan has been involved in a number of research projects, publications, and companion animal parasitology. mainly focused on vector-borne diseases, ticks, and canine gastrointestinal parasites. She is a member of various parasitology organizations, such as the American Heartworm Society, that's a biggie as well, and the American Association of Veterinary Parasitologists. Now, to Dr. Laura Greene, DVM, DACVIM, also a senior professional services veterinarian in internal medicine. Dr. Laura Greene serves as a senior professional services veterinarian and national internal medicine expert at Merck Animal Health. Prior to joining Merck Animal Health, Dr. Greene was an internal medicine specialist in a private specialty practice. One of her favorite aspects of clinical practice was taking complex concepts of veterinary medicine and making them accessible and understandable for pet owners. And I think this is a perfect format for that, because we really try to educate pet parents out there. In her role at Merck Animal Health, she speaks and writes about key topics in small animal internal medicine and veterinary practices, talking to veterinarians and their staff across the United States and sharing her passion for communication and advances in the science of healthier animals. So Dr. Greene's quote is, "Veterinary medicine is such an exciting and innovative field, and I am at my happiest when able to share my enthusiasm for all the new ways we're able to help our pets live longer and healthier lives." Absolutely. So welcome, guests.
Welcome, doctors.
Thank you so much. We're so excited to be here.
So let's get right into it. Dr. Duncan, what is Lyme disease? Can you just give us the Reader's Digest version?
Of course, of course. So I want to say thank you so much again for having us. We feel very privileged to be here to talk with you guys. And when you ask what Lyme disease is, my brain starts scrambling. Where can I go? What can I pick? It's such a huge topic. So I'm going to go with the most simplified version that I can think of, and we can expand from there. So in North America, Lyme disease, some people also call it Lyme borreliosis. It's caused by a bacteria, which is named Borrelia burgdorferi, and it's transmitted by ticks.
Dr. Duncan, can you tell us about the origin of Lyme disease? I understand that it was founded in Lyme, Connecticut. Is that true? And did we find it in humans or animals first?
Yes, that story is true. So there's a long history of evidence of Borrelia infections in mammals. The cases that have been traced back in literature, actually, that have described the signs and symptoms, we can see evidence of Lyme disease back in the early 20th century. But in regards to its current name, the disease was recognized as a cause of an inflammatory arthritis in Old Lyme, Connecticut in the 1970s. And then about 10 years after that, Dr. Willy Burgdorfer described the bacteria in full as the cause in dogs. And in the early 1980s, it was identified in dogs. And since then, and as we learn more about it, it's a cause of disease in many other mammals as well.
Let me ask you this, Dr. Duncan, because I'm very curious. How do ticks acquire pathogens and then become the carriers of these diseases?
It's a great question. So ticks are obligate blood feeders. They have to ingest a blood meal at each of the life stage. And so there's multiple immature life stages or young ticks before they become adults, and they do have to take that blood meal. And so they can become infected with these pathogens when they're feeding on these other hosts that may be harboring it. But ticks are parasites. They cause a lot of damage on their own, and the pathogens just happen to be a secondary thing that unfortunately gets passed along.
Back to me finding the tick on my thigh yesterday. I was out doing some yard work earlier in the day, so I don't think it was there very long. But, you mentioned that they're blood feeders. It was definitely attached. How long does it take before, between like you find a tick, it bites you, and you potentially get a disease from it?
It depends on the pathogen and how long that tick was attached and feeding. So when we think about ticks, and we are always thinking that, they're parasites, they're taking the blood from us, but it's actually a back and forth process. So they're feeding and taking blood in, but they're also regurgitating a lot of different proteins and products for various reasons of evading the immune system or allowing blood not to clot so it can keep coming in. Some ticks transmit actually proteins that are neurotoxins. So you hear about tick paralysis. And then during that regurgitation process is typically when they are passing pathogens. Now for Borrelia burgdorferi, causative agent of Lyme disease, it takes much longer to be transmitted. It's a unique parasite in that it resides in the midgut of that tick, and it senses that it's on a host. The tick starts to take in that blood meal, and actually it changes some of the proteins that are coated on its outside. They're called outer surface proteins. Dr. Greene describes this wonderfully when we do CE together. She says it's changing its outfit before it leaves the tick and it goes into the mammalian host, but it needs that change before it can leave the midgut, travel all the way up to the salivary glands, and then go into that host. So minimum of 24 hours, but typically you'll see cited in literature 36 to 48 hours of that uninterrupted feeding to transmit that agent. Now, there are some tick-borne viruses that can be transmitted in a matter of 15 minutes. So it really does depend on what tick is attached to you and what pathogen they may have inside of them.
And when would you start seeing signs or symptoms in your pet after they've been infected with Lyme disease?
Well, I can answer that one with regards to the amount of time before you see clinical signs. And, to Dr. Duncan's point, talking about Borrelia burgdorferi as something that is it's a tricky pathogen. It does these things where it changes its outer surface protein, and it's tricky because it can be a significantly long period of time between the time that bacteria enters the body and the time where we start to actually see clinical signs in those dogs who are going to show obvious clinical signs that a pet owner could pick up on at all. So on average, the first time you might see clinical signs from infection with Lyme may be as late as 2 to 9 months after the time that you were bitten by the tick. Wow. And I always try to tell pet owners that, because they'll sometimes say to me, oh, well, I saw a tick on my dog yesterday. And that there's a lot that tick may have done, but if you are experiencing clinical signs, or your pet is experiencing clinical signs of Lyme disease today, that tick is not the one that was the culprit. It was a tick at least 2 months ago.
I've had the opposite where, maybe somebody relays that their pet has Lyme, but they're like, they haven't had any ticks on them. I use a preventative. I can't remember the last time that I saw a tick on them. But you wouldn't remember.
It was 9 months ago.
9 months ago. Yeah, exactly. Wow.
Exactly. Yeah, it's tricky and it's hard because, of course, I think we'll probably get into it a bit later, but many dogs that are infected with Lyme disease don't show obvious clinical signs that a pet owner is going to pick up on. There are ones that can be found on blood work or things that we can monitor for. But, again, that makes it very, very difficult to know when you're first going to see those clinical signs, if it's a clinical sign that you can't just see, that a pet owner doesn't pick up on right away.
So what are some of the common symptoms that pet owners should be looking for?
The classic ones that we think of are going to be something like fever, shifting leg lameness. So if one day they seem to be limping on their right front leg, and maybe even just later in that same day, that leg seems fine, but now their back left leg, they're limping on it. So that kind of shifting leg lameness. They can have a decreased appetite, or they can just generally not feel so well. And it's an interesting distinction between what we see in dogs and what we see in people. People, it's quite infamous to have that reaction on the skin from the bite site where the tick bites. They'll get a bullseye lesion. We really don't see that in dogs. We really just see, again, those kind of classic acute clinical signs. So the lameness, of course, is one of the big ones everybody thinks about. From an internal medicine perspective, the one I really worry about are those dogs that will develop kidney injury as a result of having Lyme disease. And this can be really severe. And the clinical signs you see from it can range from kind of a slow progression of typical kidney disease signs, like they're drinking more water than they would normally, or they might be urinating more or larger volumes of urine than they had previously. But in other cases, it it can unfortunately be a severe and acute, so very rapidly occurring renal failure, kidney failure, and that can be quite devastating.
We just did a show on renal replacement therapy. It sounds like something that maybe a dog with Lyme disease might be a candidate for if they had an acute injury to their kidneys.
Absolutely. Yeah, the injury that tends to happen in to the kidneys as a result of Lyme disease is one where if you typically think of the kidney as a big filter, a filter should be able to keep some things in and allow some things to pass through. And when Lyme disease damages the kidney, it's almost like it's not a filter anymore. Like it's just a great big open hole. It can't filter, it can't keep the things in anymore that it needs to keep in. And renal replacement therapy or dialysis essentially can be helpful in that situation, but there's a lot that even dialysis can struggle to keep up with. The truth of the matter is, unfortunately, for dogs that experience severe Lyme nephritis, so that severe Lyme-induced kidney injury, it is unfortunately often fatal.
So how do we diagnose Lyme disease in the patient when the owners show up with these symptomatic dogs?
Yeah, so the primary way that we diagnose Lyme disease is actually by looking for the body's response to having become infected with Borrelia, with that bacteria. And so we are looking for a presence of a specific type of antibody in the blood. And again, this is tricky because for one thing, it takes a little time for the body to make this antibody. So typically the earliest that you can detect that a dog has been infected with Borrelia is about 3 to 5 weeks after it has actually happened, because that's the amount of time it takes for the body to make up significant amounts of this antibody that we can detect it with our test. And then the catch is the only thing that antibody can tell you with certainty is that this dog has absolutely been bitten by a tick. That tick was attached and able to feed long enough to transmit Borrelia into the dog. And now we don't know. Now we don't know, are the clinical signs that this dog is experiencing definitely due to that Lyme disease, or could it be something else? Could it be a different infectious agent that is transmitted by ticks? Or could it be an autoimmune disease? Could it be, there's just so many other things that can cause similar type signs. So to some degree, at its heart, Lyme disease ends up becoming a diagnosis of having those antibodies present, having the appropriate clinical signs, and excluding or removing or making sure it's not all of the other possibilities.
Should we be testing all dogs every year for some type of tick-borne disease? So, you come into the clinic and the first thing we do every year on your annuals is we recommend the 40X. And for clients who don't know what that means we check for heartworm, Lyme disease, anaplasma, and Ehrlichia. And so clients will sometimes say, well, I did it last year, or I don't want to pay for that in addition to the blood work. But should we be testing all dogs every year for tick-borne diseases?
I tend to be a strong advocate for that. So I am going to say yes, but certainly we should be testing all dogs that live in endemic areas for Lyme every single year. And again, that gets back to not every dog is going to show visible clinical signs of Lyme disease just because they were infected. So only about 5 to 10% of dogs are going to actively show clinical signs that a pet owner could pick up on. Some unknown percentage of those will still be infected with Lyme, but not show something that a pet owner can pick up on, but have this chronic inflammation that can be bothering their joints or can be eventually causing problems for their kidneys. And so the first step is making sure we're testing to see, have they been infected? Have they been infiltrated, if you will, by this bacteria? And that tells us two things. One, it tells us that we need to have a closer look at our tick prevention, because it guarantees me that that dog has been bitten by a tick. So we need to have a good conversation about that. And two, it tells me that this dog now needs to be monitored more closely for the rest of its life. So if prior to having a positive test, I might have said, sure, come in once a year for an annual exam. Now for that Lyme positive dog, I will recommend more frequent monitoring so that we can catch any problems such as early kidney disease sooner than we would have otherwise.
You mentioned earlier, Dr. Duncan, that, many mammals have exhibited the prevalence, I guess, or the ability to get these ticks and carry this bacteria and so on. And of course, we mentioned humans. Do cats get Lyme disease? What are other common species that we should be aware of?
Certainly. So cats are one of those along with humans. We have a lot of data for those two hosts as well as horses, actually. There's a lot of growing information about that for Lyme disease in horses. And then there's definitely infections and reports of infections to a lesser extent in cows, sheep, and goats. And these are ones that we're seeing noticeable disease. Now, there are a lot of what we call reservoir hosts that can be infected with Borrelia, but don't necessarily ever develop disease. So those are typically the ones that ticks are picking up the agents from potentially. And regardless of the host, they're all infected by that feeding Ixodes tick, that tick vector, but the disease itself does manifest differently depending on the host.
Would an example of that be deer?
Yeah, the deer tick is a common name for Ixodes scapularis, which actually has kind of been replaced with the black-legged tick as the most common name for that. And when white-tailed deer come in, they're truly what I call a reservoir for the tick. So they're a great reservoir to keep this tick life cycle going, whereas the white-footed mouse in the east or the gray squirrel in the west are really that reservoir host for the pathogen Borrelia instead. But white-tailed deer are very important in supporting and maintaining the tick populations.
So we're kind of touched on like geographical regions and climate. Is there any area in particular that you might see more presence of tick-borne diseases in one area versus another area of the country? And I mean, I'm not even sure if we can even say regional specific ticks anymore, because it seems like because we take our dogs everywhere, if I brought my dog with ticks to Arizona, are they now prevalent in Arizona because I exposed them to whatever tick was on my dog?
For sure. Climate matters a lot. Ticks are sensitive to certain climate and habitat preferences, as well as they have specific host preferences that they want to feed on. And so they may be restricted to a certain geographical area solely because of that. So I live in Oklahoma right now, and I would consider this is the tickiest of all the areas. Now, I know there's a lot of people in the Northeast and the upper Midwest that feel differently, and it all depends on the tick species you're talking about. But, the geographical region, the climate, and just the general environment around where our pets hang out, those are all going to affect the level of risk for infection. And again, depends on where you are, which ticks are there, and what pathogens. But if dogs or us spend more time outdoors, and so their interactions with ticks may increase, of course, they're going to be at an increased risk for tick-borne pathogens in that case, especially if it's a woodsy area for the Ixodes species. They like that deep woods kind of habitat under all that leaf litter. And then if you're in certain areas that harbor the reservoir host for the pathogen or the ticks themselves, of course, your potential contact, and then risk goes up there too. For Lyme disease in particular, most cases are diagnosed in that Northeast, upper Midwest, and the Western U.S. because the Ixodes ticks that transmit it, so Ixodes scapularis in the Eastern U.S. or Ixodes pacificus in the Western U.S., they're more common in those regions. But there has been some incredible research that has come out to show that even within a species of ticks, there's some genetic differences that may allow them to be more successful hosts. In the South, we see the black-legged tick, Ixodes scapularis, quite often, but Lyme disease is not as common in the Southern U.S., and so that's a reason why they're looking at some of the genetic differences of maybe those interactions between pathogen and tick are different regionally. So more to come on that for sure. There's a lot that we do know about this, but I'll be the first to admit there's a lot that we still are learning and trying to understand.
You think ticks are adapting?
For sure, they definitely adapt. We're seeing ticks in areas that we never used to see ticks before. You brought up the fact that we travel often with our pets, and we may accidentally be bringing ticks along. So I think they may get put into an area that they normally, by their own means of expansion, wouldn't have gotten there. And then they can set up there are certain areas that are projected, the very bottom of Florida may become inhabitable by ticks because it'll get too hot potentially. Whereas, we're seeing expansion of areas that used to be too cold to maintain tick populations. We're seeing tick-borne diseases diagnosed there as well.
Dr. Duncan, there was an interesting story last year in the winter of 2022. Ticks were so prevalent in a certain part of Maine that they killed off 90% of moose calves. And it was such an infestation that the researchers found on these calves somewhere between 40 to 75,000 ticks on these baby calves. It's crazy.
It is crazy. I've seen reports like that. There's a tick, it's called the winter tick. It's a Dermacentor albopictus. They're particularly out, as their name would apply, in those winter months. And they are what we call a one-host tick. So they attach on as a young tick and are taking their meals continuously on that same host. So you can get an insane, severe infestation, like you said, if they walk through what we call tick blooms or something, all the eggs, all the larvae hatch out at once and they all grab on and are taking that blood meal. And actually the moose too, they will become so irritated, they will rub a lot of their coat away. And so they can die from exposure as well during those cold months.
So Dr. Greene, what are, gosh forbid, if our pet does become diagnosed with Lyme disease, what are the typical treatment options? And then maybe you can extrapolate and tell us a little bit about the progression of Lyme disease if left untreated.
Yeah, that's a question that has a lot of different answers to it because it depends a great deal on the presentation of Lyme disease that's in front of us. So let's take this in a couple of relatively brief parts. So the first one is the classic, right? You bring your dog into the veterinarian because they're lethargic, they're not eating well, and they have a shifting leg lameness, and they're diagnosed with Lyme disease. The classic treatment for that is going to be a course of antibiotics, typically doxycycline, although there are certainly others that may work as well, but doxycycline tends to be the favorite because, as I mentioned earlier, it's very hard to definitively prove that Lyme disease is the only thing that could cause the clinical signs, that fever, lethargy, et cetera, that are in front of us. And doxycycline is effective against a number of the other pathogens that are transmitted by ticks as well. So we cover our bases, if you will, by saying, well, we think it's Lyme disease, but the nice thing about doxycycline is if there's a little bit of anaplasmosis mixed in there too, or if the dog was bitten by a different tick and has some Ehrlichia, or Rocky Mountain spotted fever, or any of another number of vector-borne diseases we can mention, doxycycline is effective against those as well. And typically dogs will do quite well with that course of doxycycline. Their clinical signs tend to resolve fairly rapidly within about 24 to 36 hours or so. The course of antibiotics is longer than that, but we expect to see those clinical signs improve in that period of time. And if they don't, that's a good sign to us that we need to go back to the drawing board and revisit our diagnostics and see if something else is going on. For those pets that present with kidney injuries, there are some classical treatments that we begin that try to reduce how much the filter of the kidney is letting through. Those will typically be then lifelong treatments that dog is going to require. And it can be anything from blood pressure medications to medications that change the way the blood actually flows through the kidneys. They require a fair amount of monitoring. And so pet parents who have dogs that are experiencing that should anticipate that they're unfortunately going to find themselves visiting the veterinarian more often, because those do have to be monitored pretty carefully over time. But the big question becomes, you have a dog who presents for an annual wellness exam. They feel great. And you do that 40X snap test we talked about a little bit earlier, and it comes up Lyme positive. And the veterinarian, looks at the pet parent and says, well, we're going to do some blood work and make sure everything's okay. It all comes back perfect. So now what? Do we treat those completely asymptomatic pets or not? And it's a matter of some degree of debate. Many veterinarians do feel it is indicated to go ahead and at least do one round of antibiotics to try to knock back those bacteria levels. But the truth of the matter is we just don't know. For all we know, the immune system has already cleared the bacteria. Or in many cases, the immune system never clears the bacteria, but we don't have a good way to evaluate that. The only thing we can test is the antibody levels against that bacteria. So different treatment possibilities there. With regard to the question about what happens if it's left untreated, well, that's a great question, because again, a little bit of the unknown. We know that the body oftentimes does not clear this bacteria. And I think of it an awful lot like having a splinter. It's just this chronic source of inflammation. And we have dogs that experience what is called subclinical arthritis. So this chronic arthritis that is causing this inflammation in the joints, but isn't necessarily enough to make them all out lame or bring them up limping. But we know we don't like to have a splinter stuck in our fingers. We don't like to have chronic inflammation in our joints, and it's hard for us to measure what the long-term impact is of that. Or for those dogs that have the slower progressive kidney disease form, where it's chronically wearing down the kidney's ability to function. Are those pets experiencing chronic kidney disease where if they had never been infected with Lyme, they wouldn't have experienced that? I think we're probably moving in that direction to start talking about preventative, but I have to say, if given a choice, man, would I rather prevent this than have to try and figure out what to do in terms of treating it.
Yeah, I can't tell you how many times I have clients that come in, their dog was treated for Lyme because they were symptomatic and they tested positive on their 4DX, and then they get treated with doxycycline and they feel fine for quite some time. And then I'll see them back 3 or 4 months later, and the owner's saying, what's weird? It seems to be coming up again. Is my dog harboring Lyme disease in their body? And then it reoccurs. I just don't know. And I don't know if it's just chronic arthritis from the initial exposure to Lyme disease. I'm not certain.
What's tough about that is it could be either. It could be a flare-up or a resurgence, if you will, of that bacteria. Again, Borrelia, crafty little bacteria. They can actually, when conditions become unfavorable in the body, achieve this dormant spherical form that has very low metabolic requirements and can just sit there kind of being obnoxious to the body, but not actually reproducing. And so when we see a pet who's been treated and seems to be doing fine for quite some time, and then they flare back up with clinical signs, there's no way for us to determine the difference between a resurgence of an infection we thought was eliminated or the possibility that they've come into contact with another tick and they've gotten a fresh new dose or batch of Borrelia. And unfortunately, our diagnostics can't tell the difference between those.
Do you think that there is any evidence that there's any analgesic property to doxycycline when we treat these dogs? That they're responding to that and maybe they're getting a little bit of pain relief? Is that possible?
They're certainly getting some anti-inflammatory relief. So doxycycline does have some anti-inflammatory properties for the joints. And of course, decreased inflammation means some decreased degree of pain. So that is something that, again, makes it very tricky when veterinarians are trying to decide in those, again, those completely asymptomatic pets, the ones that don't have overt evidence of joint pain. Do we give this doxycycline even just because we're going to get some anti-inflammatory benefit from that standpoint? Or again, for a pet that has all of the right clinical signs and diagnostics and it looks like Lyme disease and they respond to doxycycline, but then as soon as they're off of the doxycycline, those clinical signs come back up. That may not be that the doxycycline failed to wipe out the Borrelia bacteria. It could be that something else was causing the lameness and the doxycycline decreased the inflammation in the joints. So the dog started to feel better. And as soon as you stop the doxycycline, now that inflammation starts to rear its ugly head again. So it can be quite the diagnostic dilemma. It's very important not to get tunnel vision just because there's a positive Lyme test.
So let's talk about that prevention. What are the options for people to help prevent Lyme disease in their pets?
Well, if I'm leading that question to begin with, I'm actually going to say that the first thing to do is to see about some tick preventatives. So I'm likely going to hand this back over to Dr. Duncan in short order. But But one of the things that I would say is that a positive Lyme test is, again, always an indicator that a dog has been exposed to a tick. And if we can decrease those number of positive tests because we just didn't get exposed to the ticks in the first place, I'm certainly going to be a happy camper. But Dr. Duncan, I will turn that over to you for the talk about tick prevention.
Of course. Yeah, there's a lot of options out there, so it can be overwhelming. So I'm going to break it down in kind of two groups. You've got your oral medications that are, flea and tick control or preventives. A lot of us use those terms. And then you have topical products. And with oral medications, there's a few that are FDA approved that are made just for dogs that can be bought through a veterinarian. They've got to be given as the label recommends year round to be fully effective, though. I mean, it really does just take one single gap in protection in the right time of the year. These Ixodes black-legged ticks are actually potentially out year round. The immature stages, which can transmit the Borrelia, occur in the spring and summer, and they are very small. I mean, CDC has this epic photo of a poppy seed muffin, and there's actually some larval stages of Ixodes scapularis on there, and they blend right in with the poppy seed. So those are a very sneaky way, but those are out in the spring and summer, whereas adults, which also can transmit the Borrelia, are out in the fall and the winter. So important to have that year-round control. And ticks can easily come back into the pet's environment. They're constantly being reintroduced through wildlife, through ourselves. And so you got to always stay on those products if you truly want them to be effective in helping us prevent these infections. Now, if we move to the topicals, there's even more options. Both FDA and EPA have approved topical medications. They come in a large volume of liquid that you typically put, at the base of the neck or along the back or the dorsum of the animal. There's sprays as well, and then some collars, and they all have varying time of efficacy. You've always got to read that label, so important. And those topicals don't just kill the ticks, they also can repel. So some of them may have repellent properties, and that can be really helpful if your dog or you or your cat, when you're looking at these products, human products as well, or the cat products. If you're going into area that's very ticky, let's say you're going on a hike that day, sometimes it's nice to have that added topical application for those repellent properties. So many options out there. Besides, tick prevention, there's also vaccines, which I'm going to pass back to Dr. Greene because that is definitely her specialty on that.
Yeah, so with regards to vaccination, again, this is two sides of the same coin, right? That we ideally can try to use our tick preventatives so that you have that layer of protection. But just like when you get in a car, you want there to be multiple layers to protect you, right? You want to have a seatbelt and you want to have airbags. I think about tick prevention and vaccination the same way. And vaccination in particular is so important for dogs that are living in Lyme endemic areas. And just to kind of say a little bit more about the vaccines, they are really cool the way they work, because what these vaccines do is they actually teach the body how to defend against this bacteria. And they teach it by teaching it the type of antibodies to make against the bacteria. And speaking specifically, of course, as part of Merck Animal Health for the vaccine that they make, the Novavax Lyme vaccine teaches the body to make antibodies against that outer surface protein that the Borrelia expresses while it's inside the tick, and also teaches the body how to make antibodies against the outer surface protein that Borrelia makes once it's actually in the dog. And what's so cool about that is that if you have a tick that manages to bite a dog and start to take in that blood meal, they're actually taking in the antibodies that can kill the Borrelia inside the tick, which that just blows my mind. How cool is that?
It's very cool. It's very
cool. But you don't want to have just that one layer of protection. So if any of those Borrelia manage to make it over into the dog, you have those antibodies that attack the Borrelia once it reaches the dog too. So double layers of protection, tick preventative and vaccination. Again, I'd much rather prevent than have to try and treat.
First of all, Dr. Duncan, I will never eat a poppy seed muffin again. Thank you very much. But I just wanted to ask you, Dr. Greene, the Lyme vaccine is an annual thing too. Like we want to booster that, right?
Yes, absolutely. That is something that is going to need a booster every year.
And I would assume that the cost of prevention is much less than the cost of treatment. True?
I think it certainly ends up factoring out that way in the long run. Again, some of this are unknown costs. If you say, well, 5 to 10% of the dogs are going to display those clinical signs that a pet owner can see, and you go in and you get your course of doxycycline, but then did we ever actually really get rid of that Borrelia? We don't know. Is it going to come back? Is that chronic inflammation in the joints going to make the pet more likely to have other problems? There was one study that was looking at dogs in a Lyme endemic area with ligament tears in their knee, what's called a cranial cruciate tear, like an ACL tear in a person. And the dogs in a Lyme endemic area with cruciate tears were more likely to have been Lyme positive than comparable age groups and groups of dogs that were not Lyme positive. It's a correlation. It is not a causation, but the point is we just don't know what that chronic inflammation can do, and the cost that is added up to all of those potential complications can be extraordinary. And if we get back to, when you were talking about continuous renal replacement therapy, well, that's many thousands of dollars, and absolutely your preventatives are less expensive than that.
That's, as a physical rehabilitationist, that correlation between cranial cruciate ligament tears and Lyme disease, that's fascinating.
Right.
I've never heard that before, but makes sense.
Dr. Greene, why don't we talk a little bit about the role of physical rehabilitation in our patients with Lyme disease, since we've been talking about a little bit about CCL tears and chronic osteoarthritis?
Yeah, so from the standpoint of pets that develop these clinical signs of lameness, the best case scenario is that we treat them with antibiotics and they respond beautifully, and with any kind of luck, that's the last that you end up actively thinking about it at that time, besides more chronic monitoring. But there's certainly a percentage of our patients that experience more chronic joint inflammation and therefore could use a little extra help, could use some additional support. And certainly one of the ways that we can help them with that is with physical rehabilitation and getting them to be able to move those joints in a healthy way. And there's a science to that, as of course you absolutely know and are well familiar with. There's a difference between the kind of healthy joint movement that kind of goes along with that use it or lose it kind of joint mobility versus the types of high impact things that are sometimes part of our pets' daily lives. But absolutely, I certainly advocate for those pets that are experiencing that to get in touch with a good rehab organization and look into the possibilities of doing that.
We also work with a fair amount of other people who are sort of, what you call maybe adjunct to physical rehabilitation. And we see patients who get good response from the combination maybe of rehabilitation and acupuncture, or rehabilitation and laser therapy, or rehabilitation and chiropractic.
Yeah, and I think we're learning more about those areas and how they can benefit our pets all the time. And, that kind of even segues a little bit into a discussion of what kind of alternative treatments there are. And I will certainly be quite forward about saying that my area of expertise is primarily in that sort of classical treatments, the antibiotics and the renal replacement therapy and all of those sort of things. But there are certainly other avenues of treatment that people are very interested in pursuing. And the primary message that I would advocate for, that I would want pet owners to be aware of, is just making sure that there are good open lines of communication between all of the experts that you potentially engage to help manage your pet's care, because certainly these different modalities, these different ways of treating our pets can be very complementary, but but those open lines of communication are important to also make sure they don't clash with one another. And so just making sure that everybody has a good idea of what's going on, what treatments are being engaged in, really ultimately results in the best care for our pets.
So, Dr. Duncan, if we find a tick or two,
40
or 40, what is the best method to remove that tick and why? And, when I was a little kid, growing up in Iowa, I remember I had a tick in my head, in my hair, and, everybody would gather around and ooh and ah, and then they get out the match and put light the match and blow it out and then put the hot end of the match on the tick, because they said, oh, you have to make sure that it backs out and that you get the head. You have to get the head out. And I'm thinking that's a myth. But anyway, I'm curious to hear what you say, Dr. Duncan.
So where I grew up, there were all sorts of methods of how we'd get ticks out. The hot match was a way that was done, or Vaseline, nail polish. But I have since learned through training and mentors that when we improperly remove these ticks, we actually are increasing the chance that they may transmit a pathogen because they may regurgitate in that process. So what I do instead, which is what I teach mostly, is that you want to grab that tick with forceps or some sort of tick tool on the mouth parts as close to the skin as you can. So without grabbing the skin, but as close as you can get. And you are going to have just steady rearward like traction backwards. So just one good pull back. And that's the best way to do that. And I understand that sometimes it's hard to get a good grip, or maybe it breaks off and it's left there. And that is something that I then usually take to my veterinarian and I say, I need some help, getting out the mouth parts of this tick, because it is important to get that if you can, because when you leave that almost foreign body in this open wound, an infection can take place with that. And so you would want to remove that potential source of inflammation for that. And when we think about where we find ticks, of course, they can attach and make a meal on us and our pets anywhere. But some researchers found that for Ixodes species in particular, they actually were more likely and more often found around the head, neck, and the ears for this particular tick species. So when you're looking at a dog or cat and you're trying to find ticks, it's really important to do it very systematically. Start in one portion of the dog and go through it and part the hairs and look. And as you can tell, they could be very small, those immature stages, as we talked about earlier. So going through that, and if you're looking for Ixodes, the tick that can transmit Lyme disease agent, then definitely focusing in that head, neck, and area may increase your chances of finding those and getting those out the right way.
I recently learned that ticks can also attach to the gums, which I never thought of. Maybe a different species, but but if your dog is amenable or your pet is amenable, you might want to check there too, because if you think about it, they're sniffing, and their heads are down in the grass and what have you. So that kind of makes sense. And then I've heard that there can be dozens between the toes and then, amongst the pads of the feet. And that's probably not a place that a lot of people would look. So
for sure. No, that's definitely, and it is sometimes dependent on the tick species, but I've seen incredibly horrific photos of just loaded paw pads with ticks, or around kind of the anus, or filled with the whole inside of their ear with different ticks. So that definitely is something that can happen. The most notorious tick for that is called the brown dog tick, and it typically likes living around dog kennels and things. It loves dogs. It's its favorite host. So that's why sometimes we see those intense, severe infestations. Typically a follow-up question I get is, once I remove it, what do I do with it? And I prefer, wrapping it in some tape and really immobilizing it that way, because you hear about people taking them and rinsing them down the sink or flushing them down a toilet, but that doesn't necessarily always kill them, and they may crawl back up, which that would be terrifying. So I like wrapping it in that tape and then throwing it away. The most ideal thing to do is to wrap it in a piece of tape, put it in a baggie, put it in the freezer. So if in a few weeks your pet is showing any signs of a tick-borne disease, or illness, you can take that tick to your vet, because again, different tick species transmit different tick pathogens or disease pathogens, and having which tick potentially you pulled off however many weeks or months ago could be helpful for that potentially. Another thing you could do is put it in some sort of bottle with, rubbing alcohol or something, and that'll kill them as well, and then you can discard. But as someone who studied ticks for many, many years during my PhD, and I kind of have a favorite tick, and I like ticks in different ways, I like saving them so then I can know what, my pets or I have been exposed to.
Are there any new ticks that have been introduced to the United States? So for instance, we have the Lyme tick or the deer tick, and we have the brown dog tick. Are there any new ticks with new terrifying diseases that have been introduced into the United States?
So there's a lot of ticks that are already established in the US. And in 2017, we actually have a new tick in the US. It's called the Asian longhorn tick, or Haemaphysalis longicornis. It's mostly along the eastern United States right now, but I imagine it's going to continue spreading. It's been found as far west as Missouri and Arkansas, confirmed by the USDA in 19 different states. And so it is going to spread. Now, its potential as a vector of disease is yet to be determined in the US. In other countries, it transmits a variety of pathogens, but we don't quite know for in the US yet. It is not a picky eater, so we can find it on a lot of different hosts as well as us. It's something definitely to look out for. And again, this is why it's a great idea to keep that tick and bring it to your vet. I will say that testing ticks for pathogens can be a little tricky though, because just because we find a pathogen in a tick, it doesn't necessarily mean it's going to transmit that to your pet, or it already has. So maybe it fed on a host earlier on and it picked up a pathogen, but that pathogen isn't compatible with that tick. And so it'll, die off within that tick and not get transmitted on. So I prefer testing our pets for the different disease agents that may happen, but keeping the tick, the introduction of an exotic tick is definitely an example of where keeping that tick is going to give us a lot of information.
We've really been talking rather negatively about ticks. I'm sorry, Dr. Duncan, because I know you're a fan, but I also wanted to say that we learned from the podcast we did with the wildlife rehabilitator that possums love ticks. Right. And so they're called yard angels because they eat all the ticks in your yard. So maybe a pet possum would be a good preventative.
Love that.
Or don't put the possum in your yard because he's helping you. Yeah.
I think I saw a stat that in their lifetime, an opossum can eat upwards of 3,000 ticks. I mean, that's just incredible to me that they can do that.
So as we wrap up, I kind of want to circle back actually to the title, the uptick of Lyme disease. Do we have any explanation for why there seems to be more prevalence of Lyme disease? And, especially since we know more in terms of prevention and the multi-layering and signs to look for and all of that.
Yeah, you're right. Canine Lyme disease cases really are on the rise. And there's many reasons, but one of the reasons potentially is the expansion of the tick species that transmit it, that Ixodes ticks. And they can be spreading, let's say, through bird migration. So they've hopped onto a bird for a blood meal, and then that bird has migrated and they took their ticks with them. But there's a lot of efforts also to reforest or plant more trees on farmland that may be not used as much. And so whenever we're seeing that forest, potentially we're seeing increase of those white-tailed deer populations that again are a wonderful reservoir to help maintain these ticks and those cycles. And then unfortunately also we're seeing these ongoing biogeographical changes happening on our planet that are allowing ticks to thrive in areas they may not have thrived in before. And so they're going to potentially bring their pathogens with that. But beyond the tick itself, we also may be seeing more diagnosed cases because of improved diagnostics. As technology advances, we are able to potentially detect these much easier and more sensitively than we ever have before. And so you'll see a big increase in cases, usually right after an improved diagnostic comes out, which is a good thing. And it provides us a wonderful opportunity to provide education on the disease and continue that awareness about it.
Well, doctors, continue to do your fascinating research and treatments. And, we're all going to benefit because of the work that you do. I know, Dr. Duncan, I'd asked in our communication if you could provide some reliable and valid resources for our audience that they may be able to look at themselves, as well as like pictures. Like I remember in my clinic, I had, just like a card that had the different ticks and the different sizes and colors and things like that. Do you have anything like that we can include in our show notes for this podcast?
I most definitely do. CDC actually is one of my most favorite resources for ticks and tick-borne diseases. They provide a lot of great information, not just for humans, but for pets as too, since we're all kind of being exposed to these ticks. Another one that I love is called Tick Encounter. It's run through the University of Rhode Island, and they do kind of a mobile tick ID and provide you some information. And they have a wonderful resources, banked photos of ticks. So those two I definitely would go towards. And then there's one called Companion Animal Parasite Council that again can provide quite a bit of information about these ticks and tick-borne pathogens, though it is geared more towards the veterinary practitioner. But I still think I point people that way just to have a better understanding, or maybe can go to their veterinarian with questions after they've looked at those sites.
Wonderful. Thank you.
So doctors, do you have any last thoughts or pearls of wisdom you'd like to leave our audience with before we close the show?
Of course, I'll start. I think one piece of evidence or piece of information I always like to share is that we should all expect ticks when you go outside. They're very small. They may be hiding. They're very easy to miss when we're scanning over ourselves or our pets. So expect ticks. And because we expect ticks, you should really look into or research or talk to your veterinarian about tick control products, because they are truly one of the best resources and pieces of medicine that we can have to prevent these ticks from feeding on us long-term, feeding on our pets long-term, and potentially transmitting those pathogens.
And I'll go ahead and just jump right onto that and say that in having that expectation of finding ticks and knowing that ticks can transmit any of a wide variety of different things that can be not only problematic for our pets, but a little insidious in the way they come up or when you're going to see those clinical signs. Don't skip your annual exam. Bring your pets in at least once a year so that your veterinarian can do the most important diagnostic of all, which is a good and thorough physical exam, getting a chance to feel their joints, to test their range of motion, to feel their lymph nodes, to see if they're doing all right, and to run those routine screening tests that we do to make sure that everything is okay and that we're on top of things and catch it early. Don't skip those annual exams. So important.
Great advice from both of you. And finally, where can our audience find you?
So Dr. Duncan and I are both, of course, very active with a wide variety of different efforts that can be found by following Merck Animal Health on LinkedIn, on Instagram, other social media. So the best way to keep up with our various and exciting adventures is just to follow Merck Animal Health, and you'll find us there.
Fantastic. Thank you, doctors. We learned so much today, and I really appreciate you being here.
Thank you so much for having us. Always a pleasure to be able to have an opportunity like this.
Yes, thank you so much.
Very welcome, and thank you once again. Take care.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.